Bonjour à tous. Hello, everyone. I want to start today with news about changes to our Liberal cabinet team. This morning, Navdeep Bains announced that he'll be stepping down as Minister of Innovation, Science and Industry to spend more time with his family. He will continue to serve as Member of Parliament for Mississauga-Malton and will, of course, remain a key member of our Liberal team. Over the past 5 years, Nav has worked tirelessly to build a better Canada for everyone. Look no further than the program he worked on this spring to help businesses retool to make life-saving personal protective equipment. Before the pandemic, Canada produced about 1% of the domestic PPE we used. By the fall, almost half of the PPE Canada was buying was from domestic companies. NAV's work helped create thousands of jobs and support promising small businesses. He led the way with investments in cutting-edge Canadian science and in local economic growth with the innovation superclusters. He did all this while being a strong advocate for his community. So a few days ago, Nav called me up to ask to go for a walk in the snow. And I think we all know what that means in politics, so I was a little trepidatious about it, and I was busy coming up with all sorts of arguments as to why we should continue to work together the way we have been. And as we walked around the grounds of Rideau Hall, physically distanced with masks on, it became very clear that this was the right decision for him, for his family. He's been in this a long time. He was already well into politics when I got my start way back in 2006, 2007, and was a great friend to me throughout the entire time. He's continuing as MP. He's not going anywhere. But we will miss him around the cabinet table for all the insight, all the wisdom, and all the strength he brings. I also, of course, want to thank Bram, Nanki, and Kirpa for having shared him with us for all these years. His service has been extraordinary, and I know we're going to miss him, but you're going to miss him less, the three of you. Plus tôt aujourd'hui, nous avons procédé à quelques changements au sein du Conseil des ministres suite à l'annonce de Navdeep. Tout d'abord, c'est le ministre Champagne qui deviendra le nouveau ministre de l'Innovation, des Sciences et de l'Industrie. En tant que ministre des Affaires étrangères lors d'une crise mondiale sans précédent, le leadership de François-Philippe a été essentiel. Quand le temps est venu du plus grand effort de rapatriement de citoyens canadiens de notre histoire ou de sécuriser les chaînes d'approvisionnement. La dernière année a représenté un défi sans précédent à tant d'égards, et le ministre Champagne a défendu haut et fort les intérêts du Canada sur la scène internationale. Grâce à son travail, on a pu renforcer nos alliances avec d'autres pays au sein d'institutions internationales telles que la francophonie. Son expérience dans le domaine des affaires, incluant le secteur de l'innovation, est un atout important alors qu'on rebâtit une économie plus inclusive et plus résiliente. En tant que député représentant une circonscription rurale, je sais que François-Philippe continuera de porter la voix des régions, y compris dans
Minister
ce nouveau
Champagne
dossier
will
très
continue
important.
to represent Canada's regions in his new
Le
and
ministre
important
Garneau
position with this
servira
new
en
file.
tant que ministre des Affaires
As of today,
étrangères.
Minister
Que ce
Garneau
soit
becomes
ici sur
Minister
Terre
for
ou
Foreign
à partir de
Affairs.
l'espace,
Be it
Marc
on
a
Earth
toujours
or
su
in
représenter
space,
le Canada.
Mark has
Son
always
expérience
represented
récente en
Canada
travaillant
well.
avec la communauté internationale
His recent
suite à la tragédie
experience
du vol
working with the
752
international
va certainement lui servir
community
grandement
after
dans le
the
cadre de
Flight
ce nouveau poste.
752 tragedy
As
will be
Minister
an
of
asset to
Transport,
him in his new position.
Minister Garneau moved the dial on a range of important issues, including the Safer Skies Initiative and the Oceans Protection Plan. These files and others will be in very good hands as Omar El-Khabra takes over as Minister of Transport. I've known Omar for a very long time, from my very beginnings in politics. And from his recent work as Parliamentary Secretary to the Prime Minister, I know he'll do an outstanding job. Minister El-Khabra brings to the table training as an engineer and in business, a history of advocacy for public transit in the GTA, and experience with everything from NGOs to the energy sector. This is in addition to his leadership on files like public service renewal and diversity. Finally, today we also announced that Minister Carr will be rejoining the cabinet table in his role as my special representative for the prairies. While he's been focusing on his health over the past many months, Jim has remained a very active voice for Winnipeg, for Manitoba, and for the prairies. Having served as both Minister of Natural Resources and Minister of International Trade Diversification, as well as being a business leader in Winnipeg, Jim knows what communities and businesses need to succeed. He will continue to be an outstanding advocate for people across the prairies as a member of Cabinet once again. Right from day one, it's been all hands on deck to keep people safe, support Canadians, and get our economy ready for a recovery. Starting today, I will be holding a virtual cabinet retreat so that our team can meet and map out our plan to continue this work. At the top of the agenda will be the vaccine rollout. And on that front, today I have some important news to share. I can announce that we have reached an agreement with Pfizer to buy an additional 20 million doses of their COVID-19 vaccine. From our agreements with Moderna and Pfizer alone, we will now have 80 million doses of COVID-19 vaccines arriving this year. We're on track to have every Canadian who wants a vaccine receive one by September. We've let all provinces and territories know exactly how many vaccines they'll be receiving every week between now and the end of February. This will make sure that they have the vaccines and the information they need to keep rolling out doses as quickly, as smoothly, and as efficiently as possible. On top of that, we will of course continue to work to get even more vaccines delivered as soon as we can. Aujourd'hui, je peux aussi annoncer que nous avons conclu une entente avec Pfizer pour accélérer la livraison des doses de leur vaccin. D'ici la mi-printemps, entre avril et juin, nous aurons assez de doses pour vacciner jusqu'à 20 millions de personnes.
We will have doses to vaccinate an additional 20 million people. This brings us even closer to our goal of offering vaccines to all Canadians who want one by the fall. Major General Danny Fortin and Dr. New will have more information about this during their press conference on Thursday. Vulnerable persons and essential workers have already started to be vaccinated. Our government will continue to collaborate and work very, very hard with provinces and territories to ensure that vaccination continues as effectively and as quickly and safely as possible. That is our priority. Our government is doing everything it can and must to help you and your loved ones get through this pandemic safely. We're focusing on the present, but also on the future. Economic recovery must be inclusive and must benefit all Canadians. That's why we have a plan so that all Canadians can succeed. We have a plan to invest in job creation and to create 1 million jobs. We must also prioritize climate action in all of our decisions. Yesterday, I participated in the One Planet Summit with other world leaders. We discussed protecting biodiversity and protecting our climate. Canada is a world leader in international efforts in the field of sustainable development around the world. We continue to prioritize nature and healthy communities in all of our action. Our government will continue to invest so that today's world and the world of tomorrow can be healthy and prosperous for all.
Since the start of this pandemic has been protecting you and your family, whether by procuring vaccines or by bringing in strict travel and border measures. Our priority is your safety. This morning, I can confirm that Canada will extend by another 30 days until February 21st, the border measures that are currently in place with the United States. This is an important decision and one that will keep people on both sides of the border safe. Things are really tough right now, and we all want this pandemic to be behind us. There have been a lot of things you've missed out on, or given up. But what will define this pandemic isn't what we couldn't do. It's what we could do and what we did do. Your parents and grandparents need you to help keep them safe. Our frontline workers and hospital staff need you to do your part so ICUs don't get overwhelmed. Even small actions can make a huge difference, like wearing a mask or downloading and using COVID Alert. Canada has now hit over 6 million downloads of the app. That's great, so let's keep going. Of course, not everything you can do to help will be easy. It won't be easy when you say no to a friend who wants to get together, or when you cancel a vacation south. But it'll be worth it. On peut tous faire des choix pour protéger les gens autour de nous.
We can all make choices to protect the people around us. We can all do our share
Je pense à toutes les personnes au
do our
Québec qui
part to get through
respectent
this
le
pandemic.
couvre-feu
For
que la
example,
province a instauré.
Quebecers are
Je sais que ça
following
amène des
curfew
sacrifices.
rules.
Quand vous faites votre part,
And of
vous
course, this
protégez
involves
votre famille
sacrifices.
et vous êtes
When you
solidaire
do
des
your
travailleurs
part,
de
you are
première
protecting
ligne.
your families.
Pour faire
You are
face à
also
l'augmentation du
protecting
nombre
frontline
de cas,
workers. We
plusieurs
are
provinces
dealing with an
auront à
increasing
prendre
case
encore
counts.
des décisions
As a
difficiles,
result,
que ce soit en
provinces
imposant
will
des
have
restrictions
to
locales
make
ou un
difficult
confinement
decisions,
à la
be it
grandeur de
in
la
imposing
province.
local restrictions
Notre
or even
gouvernement est
province-wide
là
curfews.
pour soutenir le
Our
Québec et tous
government
les
is here
gouvernements
to support
qui prennent des
Quebecers,
décisions
to support
difficiles
Quebec
mais
and
nécessaires
all
pour
governments
assurer la
who are
sécurité des gens.
making difficult but
On
necessary
continue
decisions
aussi
to protect
d'envoyer
the
du
health and
matériel
safety of
essentiel,
their
comme de l'équipement de
citizens.
protection individuelle
We will
et des
continue to
trousses de
send
dépistage
essential
aux
equipment
provinces et aux
like
territoires.
testing kits
Il est
and personal
crucial
protective
que ces
equipment.
tests soient
It
utilisés
is
partout au
essential
pays
that
lorsque c'est
these
nécessaire,
tests and
que ce
testing
soit dans
kits
les
be
écoles ou
used
dans les centres de
everywhere
soins de
in the
longue
country
durée.
when necessary,
Pour
be it in
arrêter la
schools or
propagation
in
de la
long-term care
COVID-19,
homes.
plus de
This
gens
is essential in
doivent pouvoir
limiting the
passer
spread
des
of
tests rapides.
COVID-19.
As we
Rapid
deal with the
tests
second
help
wave,
with this.
our government will continue to support the provinces and territories with rapid tests and other tools needed to keep Canadians safe. Already, we've sent over 14 million rapid test kits to the provinces and territories, with more on the way. It's by working together that we will get through this crisis. This is the time to have each other's backs and to support the leadership communities need. Today, I can announce the appointment of Eva Ariak as the new Commissioner of Nunavut. Mrs. Ariak has been a lifelong champion for the territory as well as for Inuit languages and culture. As Nunavut's first woman premier and as an advocate for everything from housing to food security, I know Ms. Ariak will continue doing great work in this new role. This pandemic is a challenge like no other. Now, more than ever, we need to be there for each other. A little while ago, Najma and Kareem from Toronto sent me a letter about what the last year had been like for them as small business owners and as parents. Things have been tough, but they talked about how the wage subsidy helped keep their business open and how the Canada Child Benefit made a huge difference for their family. Well, on Friday, I gave them a call to see how things are going. They're staying positive, but our conversation reminded me that when we look out for the people around us, there's no challenge we cannot overcome. This will be a tough winter, but it will end. Spring will come and summer will follow. But until then, let's have each other's backs because together we can get through this. Merci.
Thank you, Prime Minister. We'll be starting with the phone today with one question, one follow-up, une question et une sous-question. En commençant par le téléphone aujourd'hui.
We'll start with
Opérateur, c'est à
questions
vous.
on the phone line. Operator, over to you.
Merci. Première question, Raymond Filion, TVA. À vous.
First question, Raymond
Merci. Bonjour,
Filion,
Monsieur le Premier
TVA.
ministre.
Thank
L'annonce
you.
sur les
Hello,
10
Prime
millions
Minister.
de doses additionnelles du
This
vaccin Pfizer,
announcement
si je comprends bien, le
about
Canada
20
va recevoir
million
davantage
additional
de doses
doses of the
plus
Pfizer
rapidement aussi.
vaccine.
Alors,
And
est-ce
also,
que
it's
ça
my understanding
accélère
that Canada will be
l'échéancier d'avoir
receiving
assez de
doses
doses pour tous
faster.
les Canadiens qui veulent se faire vacciner? Vous
Are
semblez
we on track to
maintenir
meet the goal to
l'objectif de
vaccinate
septembre
all
sur ce
Canadians
chapitre-là?
who
On
want to be
continue
vaccinated
l'objectif
by
de
September?
septembre
Answer,
pour
Prime Minister Trudeau.
vacciner tous les Canadiens qui veulent
We
l'avoir
are
et on
continuing
est
to
confiant de
aim for the
pouvoir y
September
arriver.
goal of
Mais c'est
vaccinating all
certain
Canadians who want to
qu'on
be
est en train de
vaccinated.
travailler pour
We're
accélérer ces
confident confident that we will meet that goal.
Nous allons continuer de faire tout ce qui est
We are,
nécessaire pour
in fact, working to accomplish that goal either on time or sooner. We are doing absolutely everything we can, sparing no effort to ensure that we get vaccine doses here as soon as possible. The sooner we vaccinate most of the population, the sooner we can have a more normal life.
Hard to accelerate delivery of vaccines and vaccinate as many people as quickly as possible. We are very confident in being able to meet the September deadline we've laid out in terms of getting everyone who wants a vaccine vaccinated in Canada. But obviously, if we can do it even quicker than that, that would be great news. The quicker everyone gets vaccinated, the quicker we're going to be able to get back to a semblance of normality.
En sous-question, Raymond?
Follow-up question, Raymond
Oui,
Fillon.
au sujet du remaniement, pour plusieurs,
My
c'est un signe
question is
clair à
about
l'effet
today's
que vous
cabinet
préparez pour des
shuffle.
élections cette
It
année,
seems
peut-être même
to
dès le
many
printemps.
that this is a
Est-ce le cas?
clear signal that
Non, pas
elections
du
are
tout.
coming, maybe
On a
even this
besoin
spring. Is that the
d'avoir
case?
la meilleure équipe
Answer,
possible
Prime
pour
Minister
continuer
Trudeau.
à livrer
No,
pour les
it's not
Canadiens
necessarily
pendant
a
cette
signal.
crise sans précédent.
What today's
C'est
shuffle
ça
does
notre
mean
focus.
is that
Je
we
sais
need
que
the best
François
possible
Philippe,
team
au
in cabinet
niveau
serving
de
Canadians throughout this
l'industrie,
crisis.
va faire un job exceptionnel.
François-Philippe
Marc Garneau va
Champagne will do
continuer son
an
leadership
amazing
très
job with
fort
the industry
en matière
file.
internationale
Marc
comme
Garneau
ministre
will be a
d'Affaires
strong
internationales.
leader
Je suis
in
très content de
international affairs,
ramener
foreign
Jim Carr
affairs.
au cabinet.
And I'm thrilled that Jim Carr is joining us in cabinet again now that he has gotten healthier.
Mon ami Omar Al-Ghabra pour être ministre des Transports.
We're also happy to welcome Omar Al-Ghabra, my good friend, as Minister of Transport. He is a very hard worker and he's going to do a great job on this file. This cabinet shuffle today is necessary because another friend of mine, Navdeep Bains, has chosen to step down from cabinet, as well as to not run for re-election when there's an election. Our priority is to serve and stand by Canadians. We have promised to do so. We will continue to do so.
Thank you. Merci. Prochaine question, Hélène Buzetti, Le Devoir.
Next question, Hélène Buzetti, Le Devoir. Hello, Prime Minister Trudeau. I would like to follow up on my colleague from TVA's question that he just asked. So you lead a minority government. As leader of the Liberal Party, as Prime Minister, do you commit to not dissolve Parliament between now and June? Answer, Prime Minister Trudeau. My priority is to be there for Canadians, to help them get through this unprecedented crisis. We have helped Canadians with economic measures, with health measures. That is what we are focusing on, focusing all of our attention on. We will continue to work in collaboration with other political parties. We have done so. Many of our measures, legislation, have received the unanimous support of all parties in the House. When it comes to taking necessary action, we will spare no effort to support Canadians throughout every step of this crisis. Follow-up question. But you have not said that there will not be a spring election. Are you saying that you prefer not to call an election, but that if opposition parties are not supporting you, then you will call an election? Answer, Prime Minister Trudeau. Canadians expect that their government be there for them and do everything necessary to help them. That is what we are doing. That is what we will continue to do. We are protecting the health and safety of Canadians, all while ensuring a strong economy and strong economic recovery. We know that we can get through this. What Canadians want, most of all, as a priority, is for the government to have a plan to get through this pandemic. That is exactly what we are doing, and we are on track.
Thank you. Merci. Next question, Ryan Tumulty, National Post. Line open.
Yeah, good morning, sir. With the Pfizer doses, the additional doses you're announcing today, can you give us a timeline of when you expect those to be delivered by?
As I said, we are looking at seeing those doses arrive in April, May, I believe. Minister Anand, who will be up later, will have perhaps more information on that. We're continuing to work with various vaccine companies to accelerate, to move forward, to get more doses for Canadians as quickly as possible. Right now, we've been able to give very clear direction and information to the provinces on how many vaccine doses they'll be receiving every week between now and the end of February, which allows them to plan and manage their rollout processes. But at the same time, we're going to continue working to see if we can't get a few more doses, because all Canadians want this to move forward as quickly as possible.
Following up, Ryan?
Yeah, and on Minister Bain's departure, he's been an architect of innovation in the Canadian economy, the superclusters initiative, changing some of the structures of the Canadian economy and modernizing it. Do you see that work continuing under Minister Champagne, or do you think there's time for a new approach as well?
Oh, no, I think Minister Champagne is going to be exceptional at continuing the great work that Minister Bains has laid out over the past 5 years. Innovation and science is more important than it's ever been in this pandemic and in the recovery we're looking at. On top of that, the way we work with businesses, large and small, right across the country in terms of empowering them to bring the economy roaring back as quickly as possible as we get through this pandemic is something that I know François Philippe will be extremely good at and is looking forward to doing. We'll all miss Minister Bains, of course, but we have a great team of amazing Canadians ready to continue stepping up for Canadians every single day.
And Glenn McGregor, CTV News. Prime Minister, previously we were expecting 6 million doses of Moderna and Pfizer combined by the end of March. Now you're saying as early as a month later, it could actually be 40 million doses. That's a massive increase. And I'm wondering what changed above and beyond this additional $20 million order from Pfizer. Did you agree to pay a premium in order to fast track the deliveries, or was there some other kind of agreement that accelerated it so quickly in that time period?
Again, Minister Anand will be up later and be able to go into more detail on this, but suffice it to say we have those guaranteed 6 million doses by the end of Q1 in the first 3 months of 2020, as we've always laid out. But at the same time, we're doing everything we can to bring forward more doses, to accelerate the process, because we know the sooner we get as many Canadians as possible vaccinated, the sooner we get through this pandemic.
En français, s'il vous plaît.
Nous continuons de regarder d'avoir 6 millions de doses, c'est-à-dire 3 millions de personnes vaccinées avant la fin de mars 2020, dans les premiers 3 mois de 2020. Mais évidemment, nous allons continuer de travailler très fort pour amener plus de doses plus rapidement, et la ministre Anand va pouvoir en parler en plus de détails d'ici très peu.
Radio-Canada, on comprend que vous dites que la priorité, c'est la lutte contre la COVID, mais une fois que tout le monde va être vacciné en septembre, est-ce que ce sera le temps à ce moment-là d'aller en élection? Est-ce que c'est une possibilité?
Je pense que les gens comprennent qu'on a beaucoup de travail, pas seulement pour vacciner le plus grand nombre de personnes, mais de relancer l'économie de la bonne façon. On continue d'avoir besoin de lutter contre les changements climatiques, on continue d'avoir besoin d'investir dans la science et dans l'innovation, on continue d'avoir besoin d'assurer que tout le monde a une vraie chance de réussir. C'est les choses sur lesquelles nous allons continuer de travailler dans cette pandémie et passer cette pandémie. On est dans un gouvernement, dans un parlement minoritaire. On ne contrôle pas ce que les autres partis vont faire, mais nous allons rester concentrés sur la prospérité et la sécurité des Canadiens.
Our party is
Obviously,
focused
in a
on the
minority
safety and
parliament, we don't
prosperity of
control what
Canadians.
other political parties say or do. But we will continue to focus on getting Canadians through this pandemic, which, yes, means vaccinating as many people as possible, as quickly as possible. But it also means making sure our economy can come roaring back with continued business supports, with investments in innovation, in science, and technology, with support for the fight against climate change and supports for Canadians who've been marginalized and fallen through cracks for far too many years before this pandemic exposed them. We have an awful lot of of work to do, and our government is focused on doing that work.
Prime Minister Mike Lecouture from Global National. At the end of last year, in several interviews, when you were asked about the possibility of an election, you said you didn't want an election. Today, it looks like you're preparing for one. So I just wanted to ask you, between that walk with Mr. Baines and today, did you or your office specifically ask cabinet ministers if they were ready to continue on with the team and run in the next election so that you could make this shuffle today?
No. From the very beginning of any minority parliament, every political party understands that elections can happen. But as I've been consistently saying, we don't want an election. We need to continue to work hard and focus on Canadians, on delivering supports, on keeping Canadians safe, on creating and continuing to deliver our strong plan that is going to bring the economy roaring back and make sure that Canadians get through this the right way. That's our focus, and I certainly hope to be able to work constructively in Parliament this spring, this winter and spring, to be able to deliver those things for Canadians.
Hi, Prime Minister Trudeau, Olivia Stefanovich, CBC News. Independent of what the opposition might do, will you commit to holding off an election until every Canadian who wants to get a vaccine gets one?
Obviously, that is our preference. We want to continue to deliver vaccines to Canadians. We want to continue to deliver supports to Canadians, to small businesses, to families. The priority that all Canadians have right now is getting through this pandemic, and that is what we are focused on. We've seen over the past year a tremendous degree of support for our plan to support Canadians, unanimous consent on many of the measures that we've put forward that support Canadians, and I certainly hope that continues in the House, that we're able to constructively deliver for Canadians. That's what people expect.
So I hear that's your preference, but you're not making a clear commitment. Can you make a clear commitment today that you will refrain from triggering an election until the majority of Canadians are vaccinated?
My commitment is to doing whatever is necessary to support Canadians through this pandemic. We will continue to deliver supports for families. We will continue to be there for businesses. We will continue to be there for communities across the country struggling to get through. I made a promise standing here months and months ago that we would have Canadians' backs. And that's what we're focused on, and that's what we will continue to do.
Chris Reynolds, Canadian Press. The Federal Information Watchdog is calling for the Prime Minister's office and the offices of cabinet ministers to be included under the Access to Information Act. I'm wondering if you will honor your promise to bring your office and those of your cabinet ministers under that legislation.
In 2017, we put forward the most significant renewal of the Access to Information Act since it was created in the 1980s. We strengthened it, we expanded it. Right now, there is a review process ongoing that the Information Commissioner has contributed to, and we're going to allow that review process to continue and make recommendations about how best to move forward.
Merci, c'est ce qui met fin à la conférence de presse d'aujourd'hui.
Thank you. That
Merci tout le
concludes
monde.
today's
Bonne
press
journée.
conference. Thanks, everyone. Have a great day.
Good morning, everybody. Bon matin à tout le monde. Nous allons commencer la conférence de presse. Ministre Leblanc.
We will now start today's press
Alors,
conference.
merci,
Minister Leblanc.
merci beaucoup, Corinne. Bonjour à
Thank
tout le
you
monde. Good
very much,
afternoon.
Corinne.
Today, I am joined by my colleague, Anita Anand, the Minister of Procurement, and by Dr. Tam and Dr. New in Ottawa. I want to start today by thanking Canadians who are following their local health rules. Please continue to look out for your family, your neighbors, and your community by staying home when you can, by wearing a mask, and by always following the social distancing rules. Our government remains committed to supporting Canadians during the pandemic, and our Team Canada approach is focused always on the health and the safety of Canadians. Depuis le début de la pandémie, notre priorité est la santé et la sécurité des Canadiens. C'est pourquoi nous avons décidé comme gouvernement de rendre le vaccin contre la COVID-19 gratuit pour tous ceux et celles qui voudront se faire vacciner. It is also why we recently announced the new vaccine distribution tracker which is available online on Health Canada's website. Through this tool, Canadians will be able to follow our collective progress in the distribution of vaccines across Canada. And to speak more about vaccine distribution, I'd like to now invite my colleague, Anita Anand, to say a few words, followed by Dr. Tam and Dr. New in Ottawa. Anita?
Before I start, I would like to again thank all of our frontline workers who are facing extremely challenging conditions created by the current surge in COVID-19 infections. We know that following public health guidance is key to stemming the infection rate, and combined with the rollout of safe and effective vaccines, we will see our way through to the other side of this pandemic. Le Canada a agi rapidement pour obtenir l'un des portefeuilles de vaccins le plus
in
important
order
et
to have
diversifié au
one
monde,
of the most
en
substantial
concluant
and
des ententes avec les
diversified
fabricants
vaccine
lorsque les
portfolios
vaccins
in the world.
potentiels
We
ont
reached
commencé à
agreements
être
with vaccine
prometteurs.
manufacturers
Grâce à cette
once we
stratégie,
saw
nous avons pu
that they were
obtenir
producing
le mois
promising
dernier
vaccines.
la
Thanks to
livraison
our
rapide de
strategy,
vaccins
last
approuvés de
month
Moderna et
we
de
had
Pfizer
deliveries
BioNTech.
of
Our
approved
agreement
vaccines,
with Pfizer
Moderna
BioNTech
and Pfizer
includes
BioNTech.
a guaranteed minimum of 20 million doses with options to purchase more. As the Prime Minister announced, we have increased our order with Pfizer to add 20 million more doses for a total of 40 million doses to be delivered this year. Canada is well on track to meet our goal of ensuring that we have enough vaccines that every eligible person who wishes to be will be vaccinated by the end of September. We are focused on delivery, working every single day to get these vaccines into Canada as early as possible, as we did last month. For example, as our negotiations with Pfizer led to the advancement of additional deliveries prior to the holidays, we have now confirmed an additional 2 million Pfizer doses will be delivered in Q2. These doses were originally scheduled to arrive in the third quarter of this year. They will now be delivered in the second quarter. This is the work of my department and me every single day. That is to accelerate deliveries of vaccines into this country. Vaccines are now in Canada, and we are receiving them with greater regularity. However, we should not forget about the extraordinary environment in which we are operating. Vaccine manufacturing is already highly complex, and when we factor in unprecedented global demand and complex supply chains, we should not be surprised that the ground is sometimes shifting. I want to be very clear on this point. I have not and will not withhold confirmed information concerning the delivery schedules of vaccines. What I will continue to do is provide concrete facts so that all involved can plan accordingly with as much certainty and confidence as can be provided in the current environment. Once we enter the second and third quarters, Canadians will see a dramatic acceleration in the pace of scheduled vaccine deliveries. This is the largest mass vaccination campaign in our great country's history, and every level of government, every department is doing its part. Public Services and Procurement Canada will ensure that we remain on track to meet our September goal with the delivery of a steady supply of vaccines. Et notre gouvernement continuera d'essayer
Our
de faire en
government will
sorte que
continue
les
to
doses soient
try
livrées
to fast-track
encore plus tôt,
delivery of
afin de
vaccine
pouvoir
doses.
vacciner la population canadienne
That
le
way,
plus
we'll be able to
rapidement
vaccinate Canadians as quickly
This
as
is
possible.
a Team Canada effort. Together, we will see ourselves through to the other side of this pandemic. Merci beaucoup, Megwetch. Thank you so much.
Dr. Tam?
Good afternoon and bonjour à toutes et à tous. There have been over 668,000 cases of COVID-19 in Canada, including 17,086 deaths and over 82,500 active cases across the country. Nationally, the average case count is now over 8,100 new cases reported daily over the past week, with still increasing number of people experiencing severe illness. There are an average of over 4,500 individuals with COVID-19 being treated in Canadian hospitals, almost 850 of whom are in critical care, and 145 deaths are being reported each day. It has been a year and a day since scientists first published the genome of the SARS-CoV-2 virus that causes COVID-19. We've made substantial progress since that time with better diagnostics, treatments, and a greater understanding of COVID-19 spread and effective prevention measures. Most incredibly, our collective efforts have brought us the development and delivery of our first safe and effective vaccines against COVID-19. All around us, we can hear people saying, the light is at the end of the tunnel, but the light at the end of the tunnel is here. But though we can see the way more clearly, we are not out of the tunnel yet, and uncertainty and challenges are still ahead of us. COVID-19 activity remains at very high levels in many parts of Canada. Nationally, we are still on an ever-worsening trajectory. The months ahead will be difficult, possibly harder than anything we've experienced to date. This is no easy or fast solution, but we do know that areas of Canada that have adhered to early, strong, and consistent public health measures have been able to slow growth, keep COVID-19 at low levels, or eliminate transmission from an area. The secret to success against this virus is not easy for any of us. It means constant vigilance on the part of everyone and relentless work, together with difficult choices as capacity is stretched across our health workforce. No one should underestimate the difficulties we have faced this past year. I want to acknowledge those, from the many everyday difficulties that have built up over time to the seemingly unbearable challenges, losses, and grief. Every one of us has faced difficulty, whether it has been the loss of a job, strain on family relations or friendships, or the loss of a loved one we could not hold and comfort. To honor all those we have lost, and to care for all those who are suffering. Let's remember to always speak and act with compassion. We need this more than ever. Let's recommit to caring and kindness, and we can do this. Together, it will be easier. Thank you.
Bonjour à toutes et à tous. Il y a eu plus de 668 000 cas de COVID-19 au Canada, y compris 17 086 décès et plus de 82 500 cas actifs dans l'ensemble du pays. À l'échelle nationale, plus de 8 100 nouveaux cas ont été signalés en moyenne chaque jour la dernière semaine et le nombre de personnes gravement malades est toujours en hausse. En moyenne, plus de 4 500 personnes atteintes de la COVID-19 sont traitées dans les hôpitaux canadiens, dont presque 850 aux soins intensifs. Plus de 140 décès sont signalés chaque jour. Il y a un an et un jour, des scientifiques ont publié la séquence complète du génome du virus SARS-CoV-2 qui cause la COVID-19. Nous avons accompli de grands progrès depuis. Nous disposons de meilleurs diagnostics et traitements et nous comprenons mieux le mode de propagation de la COVID-19 et les mesures de prévention efficaces. Plus incroyable encore, nos efforts collectifs nous ont amenés à mettre au point à livrer nos premiers vaccins sûrs et efficaces contre la COVID-19. Tout autour de nous, nous entendons dire que nous apercevons maintenant la lumière au bout du tunnel. Cependant, bien que nous en savons plus sur le virus, nous ne sommes pas encore au bout de nos peines, car l'incertitude et des défis persistent encore. La transmission du virus de la COVID-19 demeure très élevée dans de nombreuses régions du pays. À l'échelle nationale, la courbe de propagation du virus grimpe sans cesse. Les mois à venir seront pénibles, peut-être même pires que ce que nous avons connu jusqu'ici. Il n'existe aucune solution facile ou rapide, mais nous savons que les régions du Canada qui ont appliqué dès le début des rigoureuses et constantes mesures de santé publique ont réussi à ralentir la propagation du virus, à la maintenir à de bas niveaux ou à l'enrayer dans certains secteurs. Le secret pour vaincre ce virus ne réside pas dans une solution simple pour qui que ce soit. Chacun doit faire preuve d'une vigilance constante et déployer des efforts inlassables. Par ailleurs, il y aura des choix difficiles à faire car les capacités de nos travailleurs de la santé sont mises à rude épreuve. Personne ne doit sous-estimer les difficultés que nous avons affrontées au cours de l'année dernière. Nous tenons à les mentionner ici. Depuis les nombreuses difficultés quotidiennes qui se sont multipliées avec le temps jusqu'aux défis, aux pertes et aux peines que nous ont paru insupportables. Nous avons tous affronté des difficultés, que ce soit la perte d'un emploi, de la tension dans les relations familiales ou les amitiés, ou la perte d'un être cher que nous n'avons pas pu tenir dans nos bras et réconforter. Afin d'honorer tous ceux et celles que nous avons perdus et de veiller sur tous ceux et celles qui souffrent, rappelons-nous de toujours parler et agir avec compassion, car nous en avons besoin plus que jamais. Engageons-nous de nouveau à faire preuve de bienveillance et de gentillesse. Nous pouvons arriver à vaincre ce virus. Ensemble, la tâche sera plus facile. Nous vous remercions.
Merci à tous. Nous allons désormais procéder avec la période de questions. We will start with questions. We will go on the phone for 3 questions, 1 question and 1 follow-up, and then we will come to the room. Opérateur?
Thank you. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de Christy Kirkup de Globe and Bell. Please go ahead. À vous la parole.
Hi, good afternoon. My question is for Minister Anand. I'm wondering if you can please provide any additional details on the timeline for these 20 million additional doses from Pfizer. The Prime Minister is saying they're set to arrive in April or May, and then he said that you would provide additional details. So can you just please provide us with any additional information on the timeline for when Canadians can expect these doses to arrive?
Well, thank you so much for the question. Let me begin by saying that it's important to remember that the negotiations continue to be ongoing. Even after today, I will be going back to the vaccine suppliers to push for earlier deliveries in the timeframes that I am giving to you today. So with that acknowledgement, we do anticipate getting a total of 20 million doses in Q2 from the 2 currently approved vaccine manufacturers, being Pfizer and Moderna. There are risks in the delivery schedule, which we believe will dissipate as production lines gain maturity. But at the current time, our estimation is 20 million doses in Q2.
And just as a follow-up, if I may, I understand the National Advisory Committee on Immunization is set to recommend on second doses. They're set to release a recommendation on second doses, and I'm just wondering how this will impact negotiations with vaccine makers, and what will the concrete impact of that be?
Well, thanks again for the question. The standpoint that I'm coming from, of course, is from a procurement and negotiation perspective. And in my conversations with the vaccine manufacturers, they have stressed the importance of following the science, or in other words, the scientific reasons that they have recommended the 2-dose regime within a certain time period for the second dose in particular. When we have additional advisories, such as the one you referred to, I will go back to the manufacturers and indicate that this has been forthcoming. But at the current time, what I am hearing from them is the importance of sticking to the recommended schedule, and the greater the provinces and territories do that, the stronger position that I have at the negotiating table in pushing for earlier and earlier deliveries. Thank you.
Merci. Prochaine question.
Thank you. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Hélène Buzzetti de Le Devoir. Please go ahead. À vous la parole.
Please go ahead.
Yes, Minister Anand, my question is also for you. So I understand that you obtained from Pfizer a quicker delivery for 20 million doses. I was wondering, following up on a question that was asked of the Prime Minister, whether or not you had to put additional money on the table to get those earlier deliveries, or I'm talking about money, but I'm talking more generally about anything else. Did you have to put something on the table in order to get those quicker deliveries? Thank you.
Thank you for the question. I just want to be clear because the first part of your question wasn't quite clear to me. So I just want to mention that those 20 million doses are as a result of exercising options. We already had 20 million doses under our original contract, and we are exercising options to acquire 20 million doses. We are on track to vaccinate all Canadians who wish to be vaccinated by the end of September. We are expecting to receive more than 70 million vaccines between Moderna and Pfizer before the end of the year. And we are also expecting a total of 20 million of those combined doses in Q2. So that clarifies the question, I hope, for you regarding the doses of Pfizer and Moderna. 70 million doses of them prior to the end of September, and 20 million of those doses in Q2. In terms of the payment of those, we did pay fair value for the additional doses that we acquired from both Pfizer and Moderna under option, and we will provide more detail on that when the environment for acquisitions of vaccines becomes more stable. Thank you.
Well, I guess my question was not clear because you mentioned that some doses will arrive earlier, and I was wondering if you had to put some extra money on the table. But I get from your answer that the answer is no. I just want, and if that's not the case, please clarify. I just wanted to turn my eyes to the schedule, the 2-dose schedule thing. You mentioned the intention of provinces to maybe delay that second doses. Can you be more specific as to the conversation you had with manufacturers in the context of trying to get additional doses? Were they any indication from the manufacturers that they are less willing to provide additional doses because of a province's intention to delay the second dose? Thank you.
Well, thank you for the question. The clarification that I want to make right off the bat is that I have no personal view on what the science is, given that I'm not a scientist and I'm not part of Health Canada, and I'm not making any recommendations myself relating to what the provinces and territories should do. I'm trying to put forward as a factual matter that in our negotiations with the vaccine manufacturers, they, of course, are concerned when the recommended doses based on their clinical trials are not being followed. And they're also concerned when they see that vaccines are not being utilized vaccines that have been delivered are in freezers, etc. And so these are 2 points that have come up in my discussions with them. One, they would like to see all jurisdictions following the recommendations based on the science. And 2, they would like to see doses used as soon as possible. Thank you.
Merci. Prochaine question. Next question.
Thank you. Next question.
Thank you. Merci. The next question is from, la prochaine question est de David Common from CBC News. Please go ahead. À vous la parole.
Yes, hello. This question is for Dr. Tam. Dr. Tam, I have a question related to long haulers. There are other countries, the WHO have urged others to take action, particularly providing additional help for those long haulers. We look at post-COVID clinics that have been set up in some countries. Canada, though, only has 3 of them right now. Do you feel like Canada is lagging behind?
So the provision of care, of course, is within the provincial territorial jurisdiction. I do know that the Canadian Institute for Health Research, for example, is supporting the further understanding of the more prolonged or longer-term impact of COVID-19. And so I think it is important to continue to get more knowledge about this, and for clinicians and others to recognize that there's a lot that we don't know about this virus, and that we need to continue to look after and support those who've had COVID-19.
I wonder if that would include those, Dr. Tam, who didn't get a positive test result because of whatever reason they were told to self-isolate or there wasn't a test available at the time. Those people who didn't have one and are now finding it challenging to find access to the care they feel they need. Is there something that your agency could do in terms of guidance to physicians on recognizing those who may not have had a positive test result but may in fact be suffering from long COVID?
Yeah, so I think we have some guidance in terms of testing or retesting people. I think the federal government's also supported, studies in terms of serologic assays. Although those are not in widespread clinical use, I think patients should discuss their situation with their physicians and look at what options are available to them for further diagnosis, for example. You can also take, of course, an actual history of exposure history and other things. So I think together, combined with that kind of history, as well as looking at what further tests can offer, can lead to the sort of clinical management plan for the patient in discussion with provinces and territories. And I think for certain patients, it may be, sort of ask the clinician to look at what the supported studies are, because by enrolling in certain research studies, you can gain a better understanding, of course, of the clinical course of disease, but also that can help individual patients as well in their further understanding of what illness that they have.
Merci. Thank you. We will now come to questions in the room for 3 questions.
Hi, Mackenzie Gray with CTV News. My first question is for Minister Anand. You just seem to take a swipe at the provinces saying that the drug companies don't like seeing the vaccine sitting in the freezers, but many premiers, Premier Ford, Premier Kenney, have been saying we need the federal government to get us more vaccines sooner so we can get them out to people. They're saying that they're going to be running out soon. So with the 20 million doses today that we have purchased from Pfizer, was a part of the deal that the delivery schedule that your government has already set out between today and March 31st, is that going to change at all? Are we going to see any new vaccines coming in outside of what you've already said in Q1?
Thanks, Mackenzie, for the question. I actually would just like to correct the way you phrased your question in terms of what you were saying I was doing. I prefer to view this effort of mass vaccinations as a collaborative effort between the federal government and the provinces. And we will continue to work with the provinces and territories and provide them with the vaccines and the supplies necessary to undertake the vaccinations at a local level. And that is what we need to do to make sure we see our country through to the end of this pandemic, regardless of whether we're talking about vaccines or any other type of initiative. This is really important to me personally, that we continue to be collaborative and cooperative together. In terms of the Q1 delivery schedule, that has not shifted at all. Indeed, we are working to make it as precise as possible. And as the Prime Minister mentioned, we have provided specifics relating to weekly deliveries that will be going to the provinces and territories so that they can indeed plan to make sure that they are able to roll out at a local level. And we are working every day to firm up delivery schedules in a week-to-week and month-to-month basis so that the provinces and territories have more information on which to schedule and base their own rollout in their jurisdictions. Thank you.
The September date is thrown around, and the Prime Minister mentioned it, and you mentioned it today. He said that every Canadian who wants to be vaccinated by September will be able to do so by the end of the month. When you say vaccinated, do you mean that they'll be able to get their first shot, or by the end of September, every Canadian will be fully vaccinated with both shots at that point in time?
Well, thanks again for the question, Mackenzie. The sands are shifting in terms of our delivery schedules. As you can see, I come to you with information as soon as I receive it and provide you with the most up-to-date information. The notion at the current time is that we are going to have enough vaccinations to at least perform the initial vaccination. But as you can see, even from our information that we're providing today, we have been working to move up the delivery of vaccines earlier and earlier into 2021. And as more vaccines come online, we know that AstraZeneca and J&J are in regulatory approval, for example. As more and more vaccines come online, we hope to be moving up this schedule even more. But at the current time, we are looking at the end of September to have all Canadians vaccinated. Thank you.
Merci. Thank you. Next question.
Hi, David Thurton, CBC. Minister Anand, do you mind just lowering the boom on your mic? It might improve the audio just a little bit. I know my radio colleagues will appreciate that. Thank you so much, but we'll see if that works. But my question is for Minister LeBlanc. Alberta's premier says that the province is considering procuring its own vaccines because it appears the federal distribution system isn't working. So, Minister LeBlanc, what's going wrong here that a province is trying to now circumvent the federal government in getting its own vaccines?
Well, so obviously I wouldn't agree with the characterization that something's going wrong here. I exchanged text messages actually earlier today with Premier Kenney, reiterating our desire to collaborate with his government. I took note of his comments yesterday. We obviously understand and share the anxiety of all Canadians that as quickly as possible, we want to have access to as many vaccines as possible. That has been our priority from the very beginning. I think this will be a successful collaborative effort. And if Premier Kenney has any suggestions of what we can do to better support his government in the vaccine logistics, of course, we want to help. But we're very confident that it will go very well. And we look forward to working with the government of Alberta very closely on this.
I'm just wondering from the federal perspective, when you hear a province saying that they intend to procure their own vaccines, what potential problems does it create for the federal government? And maybe Anand particularly, Minister Anand, you can speak to that as well.
Well, thanks so much. And I hope that the boom has been lowered enough on my mic. So let me know if it hasn't, please.
Sounds good to me.
I don't want anyone's ears to be flooded with my voice unnecessarily. Let me just say that we're going to, at a federal level, procure enough vaccines for Canadians as a whole to be vaccinated. And that is our goal as a government. That's a goal that we are accomplishing and we will accomplish. All Canadians will be able to be vaccinated by the end of September 2021. Having said that, we heard throughout this crisis from various premiers that they were looking to procure their own PPE or vaccines now, as the case may be. And we, as a federal government, are in no way inhibiting or blocking them from doing so. But suffice it to say that we have procured enough vaccines to inoculate all Canadians. And indeed, we have the most number of doses per capita of any country in the world. So we look forward to working with the provinces and territories in terms of their efforts to vaccinate each person in their province or territory, and we will continue to engage in that collaborative relationship. Thank you.
Thank you. Next question.
Dr. Tam, this question is for you. We know that long-term care residents are now really starting to get vaccinated. We've vaccinated many of the workers who work there. I'm curious, though, if we've done any modeling or understanding of what impact on the spread of COVID will be achieved by vaccinating that group. We know that they're the most vulnerable, that vaccinating them is really for them, but I'm just curious if we've done any modeling to know if that will help curb the spread in the community to any extent.
So what we do not know as yet are the effectiveness of the vaccines that we have in preventing asymptomatic infection or to reduce transmission. That data is just not there, but I do know that international studies, the vaccine manufacturers also following that. So we expect to sort of take that data in mind as we look at what the impact of vaccinating persons in long-term care could be. Certainly, I think that the primary goal is, I absolutely think that everyone has to commit to getting vaccines as fast as possible into this population. With that, you know, a month or two later, we should be able to see that there's some impact on severe outcomes. That is one of the earliest signs. At the same time, we need to keep layering on all the protection to prevent the entry of the virus into those populations, and that has to continue infection control. So I think it remains to be seen, but this will be the earliest population, perhaps, of which we can look at that estimate.
And on rapid tests, we heard the Prime Minister today talking about the need to use rapid tests more. But my understanding is just still that most rapid tests are not actually all that good for people without symptoms. And so using them as a way to sort of go in and mass test people who aren't showing symptoms isn't necessarily going to be helpful. Do we have any rapid tests that we can rely on to do that kind of testing yet? And if we don't, do we know that there's any that we're looking at?
Yeah, so the Public Health Agency does have testing guidelines, and that includes the application of what we call point of care testing. And because they are actually different, there's different kinds of point of care testing. For certain situations, such as in high-risk populations, when you're doing an outbreak investigation, the most accurate tests are still the molecular tests or the PCR, but those can be points of care and can be actually rapid. What you might be referring to is antigen testing. That's another different kind of rapid test, and we also have some guidance on that. They do have some limitations in terms of the sensitivity, the ability to detect the virus, because they don't have an amplification step. But there are ways to apply them. If they're freely, they're widely available, they can be fast. What you need to do is reduce that uncertainty by doing serial testing, for example. That can happen. In an outbreak setting, you can combine molecular testing, but also utilize antigen testing to broadly screen a population. Say if you're in an enclosed environment, you know that the virus is there, in which case that increase your probability that if you get an antigen test, for example, that is going to show you the results. And then you can do better infection control in those settings as well. So I do think that because there's now quite a millions of these tests that have been provided, we have to work diligently with the provinces to see how they can get them out as fast as we can. Long-term care is a case in point where I think testing adds another layer of protection to this environment.
Merci. Nous allons retourner au téléphone pour 3 autres questions. We will head back to the phones now. Opérateur.
Thank you. Merci. The next question is from. La prochaine question est de Émilie Bergeron de l'agence QMI. Please go ahead. À vous la parole.
Agence QMI.
Hello. I just need a clarification from Minister Anand. You mentioned earlier that the 20 million doses, additional doses announced today, are part of you exercising the options to get more vaccines. So, if I remember well, the option it was 56 million doses. That were possible to add. So does it mean that the total option is applied with the 20 million doses, or you could decide to exercise again this option to have more doses eventually?
It's a great question, Emily, and thank you so much. Merci beaucoup. We are exercising 20 million options of the Pfizer vaccine to give us 40 million doses of the Pfizer vaccine at the current time. And we still have the ability to exercise 36 million more options of Pfizer if we like. And for that matter, we can also go back to Moderna and negotiate for additional doses if we wish to do so. And let me just tell you from my standpoint and my department's standpoint is that in those negotiations, we are driving hard towards ensuring early deliveries of the vaccines. So the reason why we chose to exercise those 20 million more Pfizer vaccines is because we were able to have assurance from the manufacturer that the large bulk of those would arrive in Q2 and Q3. And so we want to make sure that the exercise of options is tied to early deliveries, and that's what we've been able to do with both Pfizer and Moderna in the exercise of 20 million more doses of each of those suppliers. So I hope that answers your question.
Yes, thank you. As a follow-up, peut-être Dr. New ou quelqu'un d'autre qui aurait une réponse à ça. Concernant le taux d'occupation dans les hôpitaux et le possible débordement à l'horizon, qu'est-ce que le fédéral peut faire au niveau de fournir des lits supplémentaires, mais surtout des ressources en personnel supplémentaires parce que c'est ce qui risque de manquer en premier. Donc, qu'est-ce que le fédéral peut déployer de plus à ce niveau-là?
What can the federal government do to help?
Oh, merci. Je ne sais pas, est-ce que le ministre Leblanc va commencer en général?
Minister Leblanc, would you like to answer?
Allez-y, Dr. New, allez-y.
OK, non, je parle de la perspective de la santé publique. Notre agence aussi avec Santé Canada, on a toujours prêt à supporter nos homologues des provinces et territoires. C'est sûr que les systèmes de soins de santé sont presque débordés dans plusieurs régions du pays. On est toujours prêt à fournir toute une gamme de ressources pour augmenter la capacité des provinces et territoires, comme les épidémiologistes aussi, personnel pour assister avec le suivi des contacts. Il y a toute une gamme, même des établissements pour isoler le personnel, peut-être s'ils sont exposés et dans des situations, c'est mieux d'être dans autres établissements séparés de peut-être la famille
Sometimes it's best
toute une
to
gamme. Donc,
isolate
on est toujours prêt, mais
away from one's
c'est toujours
family.
exige une
So
demande
we have
comme
many
formelle des
options
provinces et
and many
territoires
ways
et
in
on
which
continue de
we can
travailler
help
étroitement avec nos homologues.
if we receive requests from provinces and territories, and we work closely with our counterparts.
Merci. Prochaine question.
Thank you. Next question.
Thank you. Merci. The next question is from. La prochaine question est de Mélanie Marquis de La Presse.
Mélanie
Please go ahead. À vous la parole.
La Presse. Please go ahead.
Merci. My question is for Dr. Tam. Could you provide us with an update on the AstraZeneca approbation process, please?
Yeah, unfortunately, I'm not the regulator, so that we can be posed to Health Canada. But what I do know is that they are still reviewing the information, and that data has been coming in. So I don't have a line of sight on that, unfortunately.
Is there, still following up on that, is there some kind of a holdup because of, I know you're not the regulator, but in your opinion, according to the literature, is there a holdup because of the problems AstraZeneca experienced during the trials?
All I know is that Health Canada has requested clinical and other data and manufacturing data from the manufacturer or the company, and they're working those through as fast as they can. So I think that's probably all that I can say.
Merci. Prochaine question.
Thank you. Next question.
Thank you. Merci. The next question is from. La prochaine question est de Xiao Lili de CTV News. Please go ahead. À vous la parole.
Good afternoon. This is another question for Minister Anand. I'm looking for some clarification on the Pfizer vaccine option being exercised. I understand Canada previously declined an option for more Moderna vaccines. What were the factors in decision-making and deciding to exercise one option and declining another, knowing that one of these vaccines requires some fairly specialized cold storage?
Thank you so much for the question. Actually, I just want to clarify that we did exercise 20 million Moderna options. So in other words, we contracted for 20 million. We had options on additional Moderna options, and we chose to exercise 20 million of those options. And as I answered previously, the rationale was because we knew that we could, after negotiating with Moderna, receive those additional 20 million Moderna options prior to the end of September, which is our goal to ensure that all Canadians are vaccinated by. And so I believe you're referring to 16 million options that Canada chose not to exercise. And I will say simply that we didn't have the assurance from the supplier with regards to those 16 million that we would receive them by the end of September 21. But I will add that we have the ability to go back to Moderna and negotiate for additional doses should we decide to do so. But given the large number of doses in our portfolio and our ability to secure earlier and earlier doses through the exercise of the now total 40 million options, if you combine Moderna and Pfizer together, we are well placed to ensure that we will meet the September 30th deadline, if not before. Thank you.
Thank you for that clarification. Just as a follow-up, I just wanted to ask another question with respect to what the Alberta Premier expressed his sort of dissatisfaction with this federal purchasing and distribution strategy. Could you just reiterate some of the advantages and disadvantages of Canada buying vaccines all as one rather than all the provinces going to market?
Well, thanks again. What we saw through the first part of the crisis in our purchase of personal protective equipment and what we are seeing now in the purchase of vaccines is that the vaccine companies are very willing to do negotiations and contracts with us because we are buying in bulk for the entire country. And indeed, when you look at the population of Canada, which is about 37 million, that is relative to the rest of the world, not a large population. And so we really need to band together, I believe, to ensure that we are putting the best foot forward as a country in negotiating for the entire country. And that's exactly what the government of Canada has done with fortitude. We have secured the largest per capita doses of any country in the world. We have enabled ourselves to be at the front of the line of Pfizer and Moderna for the initial doses of vaccinations. We have ensured that all jurisdictions in this country are offering inoculations at the current time. And so our very tough negotiating stance back in August and September is continuing to pay off, notwithstanding the fact that we are continuing to negotiate hard with all of these suppliers, Pfizer and Moderna included, and I am engaged personally with them as well. And so we are very willing, of course, to continue to negotiate for all Canadians, and we will continue to do so. That is our role as a federal government, and we look forward to continuing to support the provinces and territories in their rollout of the vaccine campaign.
Thank you. We will take a final question in the room and then a final on the phone. So 2 last questions. McKen.
Dr. New, I've got a sports question, so I'll pose it to you. I think I don't mean to offend you, Dr. Tam, but normally he takes the sports questions. Eugene Melnyk, the owner of the Ottawa Senators, he's just tweeted saying that he's submitted a robust safety plan that will allow for 6,000 fans to see Senators games in the Canadian Tire Centre. I don't know if that falls into your federal jurisdiction, but do you think it's appropriate at this point in time that we have indoor spectators at hockey games?
Thank you very much for the question, Mackenzie. And you're right, that's not within the federal mandate. Our federal mandate, as you well know, has been with our international borders. So when it's sort of related to the sports files in the past, I certainly put forward sort of the federal government's position with respect to crossing the international border for, let's say, sports teams being the Blue Jays in the past and the Raptors. In this case, with the NHL, now that they have sort of a northern division, the NHL certainly took into account the federal stance on the border, and all of the Canadian teams will be playing exclusively in Canada. And so it really was a more sort of a provincial sign-off that was needed in terms of allowing teams to play in Canada. With respect to local situation, I would certainly defer to local public health authorities. The medical officer of health, Dr. Retch, is here in Ottawa in terms of what would be appropriate in terms of public health measures, in terms of group sizes, how many people can gather together for any type of event, be it sporting and otherwise. So that's how I would leave it. Thank you.
Merci. Nous allons donc passer au téléphone pour la toute dernière question. We will now take a final question on the phone. Opérateur.
Thank you. Merci. The next question is from. La prochaine question est de Diana Gonzalez de Radio-Canada. Please go ahead. À vous la parole.
Hi, this is a question for Mrs. Anand. This is Caroline Quash from the National Advisory Committee on Immunization said today that they recommend to give a second dose of vaccine no later than 6 weeks after the first dose. What do you think about that?
Merci beaucoup pour la question et je vais commencer avec quelque chose.
Thank you for your question. I will start
Dr. Tam and Dr.
by responding, and then I will give the floor to Dr. New and Dr. Tam.
My role is as the procurement minister, and so I will bring this information from the National Committee forward to the manufacturers and discuss that with them and see if their views in terms of their recommendations change, and as a result, whether our ability to secure doses is altered at all. But at the current time, and today especially, I think we should think very positively about what the federal government has been able to do. We are exercising 20 million options of Pfizer. We are ensuring that we have 20 million of Pfizer and Moderna doses in this country combined in Q2. We are ensuring that we will have 70 million vaccines between Moderna and Pfizer in this country prior to the end of September, so that all Canadians who wish to be vaccinated can be vaccinated. And so those accomplishments are as a result of our ability to negotiate with the vaccine companies, our ability to get results from these companies, our ability to move Canada up in the line time and again for acquisition of these vaccines. And of course, we will not stop. We will continue to press these companies for earlier and earlier doses. That is our obligation, and that's what we will continue to do on behalf of all Canadians in this country. Thank you.
C'est Dr. New. Je ne sais pas, est-ce que vous voulez une réponse en français ou en anglais?
Dr. New here. Would you like the answer in English or
En
in French?
français, c'est mieux, oui.
Oh, c'est mieux en français, OK. Peut-être je peux commencer aussi à demander peut-être à Dr. Tam à ajouter quelques commentaires. Quelque chose est sûr, avec les deux vaccins homologués ici au Canada, selon les données probantes soumises par les entreprises de Pfizer et Moderna, c'est sûr, c'est pour un régime avec des deux doses, ça c'est sûr. Aussi, tous les homologues des provinces et territoires, on est tous sur les mêmes pages. Idéalement, c'est vraiment donner deux doses à chaque personne pour l'administration des vaccins. Mais on sait actuellement la quantité des doses sont limitées au Canada. Donc, parce qu'on voit qu'est-ce qui se passe actuellement sur le terrain avec l'épidémiologie, il y a beaucoup de personnes atteintes avec l'infection, aussi maladies graves et aussi des décès. On va aussi protéger le plus grand nombre de personnes possible. Ça, c'est l'enjeu actuel. Donc, on a posé la question à la Comité consultatif national de l'immunisation pour leur conseil. Et aussi, on regarde qu'est-ce qui se passe aussi, parce que c'est le même enjeu dans plusieurs pays à travers le monde. L'OMS a dit avec les données disponibles à date que peut-être qu'on peut avoir un délai avec l'intervalle de 21 à 28 jours jusqu'à peut-être 42 jours. Après ça, on n'est pas vraiment de données pour donner une recommandation. Je pense que notre comité consultatif national de l'immunisation, Dr. Quash, elle est la présidente, co-présidente du comité. Prochainement, je pense aujourd'hui, le comité va publier leurs recommandations. Je pense que ça va aussi souligner les mêmes principes. On a déjà constaté qu'en général, au Canada, on a toujours dans l'espace de recommander les deux doses. Mais on doit avoir un peu de flexibilité en examinant c'est quoi la situation épidémiologique dans plusieurs régions du pays. Mais avec les données probantes, c'est vraiment jusqu'à peut-être 42 jours, on a des données que c'est encore efficace. Après ça, s'il y a une province ou une administration qui veut peut-être avoir un délai plus long. C'est très important d'avoir des études, de recueillir les données pour examiner c'est quoi l'efficacité avec un intervalle peut-être plus long. Avec ça, peut-être je vais donner... Non, Dr. Tam, on est bien. OK, merci.
Dr. Tam, anything to add? No? All right, then. Thank you.
Mais donc, est-ce que 6 semaines, ça serait quelque chose d'acceptable?
Would a 6-week interval
Oui, idéalement, si on a beaucoup de vaccins aujourd'hui, c'est sûr, tout le monde va suivre l'intervalle de 21 ou 28 jours selon quel vaccin Pfizer ou Moderna. Mais ça, ce n'est pas le cas actuellement. Donc, avec les données probantes disponibles à date, avec tous les scientifiques et les autorités qui ont examiné, même l'OMS a constaté que oui, c'est possible d'avoir un intervalle jusqu'à 42 jours. Donc, je ne peux pas dire qu'est-ce que le Comité consultatif national d'immunisation va dire, mais je pense qu'ils ont examiné les mêmes données probantes et ils vont publier leur conseil, je pense qu'aujourd'hui, peut-être cet après-midi.
Parfait, merci beaucoup. Thank you everybody for joining our press conference. This was an end to today's presser.